who's telling the truth? Is it Rubio calling out Fauci, or is it Fauci? Because I'm confused. Someone that's not is the managing partner of PCS Advisers, good guest of this program. He is Paul Seegert, and he has a consulting firm based in Northern California, and he's joining us right now on 700 WLW. Paul, how are you on this glorious Tuesday?
Doing fantastic, Ken. How are you doing?
I'm doing well. I think I've been deceived. I'm not sure when, but I know it's happened along the way. I don't trust anybody when it comes to this. I just saw a report this morning, I think it was on Fox News, about a Minnesota doctor and one of his clients, about how they've been manipulating in Minnesota the COVID deaths, where if you die in the hospital of something and you also happen to have COVID-19, the hospital gets extra money because you died on their watch. And, oh, yes, in addition to cancer or in addition to a heart problem or a kidney problem, you died of COVID, the hospital gets money. I think it just plays into this narrative that I think a lot of us have just tuned a lot of this out. And I think that's dangerous, don't you?
It is. I mean, if you look at you can go to the CD site today and pull up a map of the flu season this year and compare it to a map of the flu season last year. And amazingly, there's just very low flu season this year. And there are economic drivers that unfortunately influence behavior. And so it does shed some doubt on what people are hearing. And there have been conflicting stories or conflicting guidance. So I certainly can see where it would lead to confusion for lots of people.
Well, so Rubio gets into this tete-a-tete with Fauci in the last 24 hours, 48 hours. Look, Anthony Fauci operated basically out of the limelight for 40 years. Nobody knew who this guy was unless you were somebody who was in the same line of work he was in, or if you paid attention on a daily basis to what was going on in NIH, and very few of us do. Now, all of a sudden, we get the pandemic. He's anointed by President Trump, and this guy has become, he's a media darling. He's like a moth to lights. He'll just go anywhere there's a camera and there's lights. And I'm just wondering if, at the root of it all for Anthony Fauci, if he's just not another political animal in Washington, D.C. What do you think?
Well, there have been conflicting stories. I can certainly attest to that. Early on, we were told that herd immunity would be achieved around 70%. Now, I've cautioned people all along the way, every chance I've had to talk about this, that they're basing so much of this on guesswork. I mean, we don't really, all of these herd immunity estimates are a result of figuring out how easily a virus transmits from one person to the next, and they assign a number to that. It's called an R-naught factor, but for simple kind of conversation about it, measles is the most contagious. When you get measles, you're going to infect 12 to 18 other people, so they assign it a value of 12 to 18. And we really don't know what that value is for COVID-19 because we've artificially locked down the population so much. And so they're erring on the real high side, because if you look at how it's actually spreading, it appears that it's probably around 1.0, 1.1 in many areas, so way less than the measles.
Right. And people have had their lives turned upside down, and they've lost their livelihood. They've lost, in some cases, their business. And, again, Fauci defends himself by saying, when polls said only about half of all Americans would take the vaccine, I was saying herd immunity would take 70 to 75%. Then, when newer surveys said 60% would take the vaccine, I thought, well, I can nudge this up a bit, so I went 80 to 85%. This goes back to my big beef with everybody, unelected public health officials, and some politicians. Just say, I don't know. We don't know.
Exactly.
If you had said that, I think you wouldn't have had what you've got right now, which is a great distrust in a vaccine that's probably pretty good. In fact, if you believe the efficacy rates, it's better than any vaccine that's ever been developed. And I think you've got a great distrust of everybody that's involved in this argument. Why can't people just say, I don't know?
Well, you make a great point. Now we're hearing up to 90% may need to get vaccinated for herd immunity, but the math would suggest it's likely quite a bit less than that. We can achieve herd immunity against the measles at 93 to 95% of folks being vaccinated. So if it's the high water mark of how contagious a virus can be, and it appears to be far more contagious than COVID-19, then likely we wouldn't need to be at that 90% number.
Yeah.
So it's probably, it does seem to be inflated, and I'm glad that he's saying, hey, these have been based on guesstimates, because that has been evident all along. You look at this new variant in the UK, and if you read about it, there's a lot of concern about that because it's supposedly more contagious. But by the time you get down to the third or fourth paragraph in most of the articles that are written about it or papers, they admit it's based on modeling, not on actual empirical evidence. Yeah. It's okay. Just let us know. Hey, we're figuring this out as we go a little bit here.
Right. And I mean, you had the Surgeon General, Jerome Adams, all the way back in February when this first started, telling Americans stop buying masks. Then Fauci and he and other people were saying that masks are the best way to stop the spread of disease. And it's like, I think you got people's head spinnings right now. All they want to do is get their life back. They're scared to death of this thing. The numbers of people that are infected, we know, are greatly skewed to the elderly and elderly inside of nursing homes. I just don't know why we have so many people out there freelancing about this. When you're looking for information, Paul Seegert, where do you go? Who do you listen to?
Well, you have to pick through it very carefully. I look at all the various sources, and when you go to as I mentioned before, though, you have to really pick through the data. If you look at the CDC's own website and you look at a COVID-19 map today, and then you look at a flu map, magically there's very little flu, and that's pretty unlikely, right?
Right.
And so you have to do some serious digging and education and parse through it all, and it's not that easy to do. But there are examples around the world where they're not putting their populations under these draconian lockdowns or these very severe lockdowns, and they're achieving very good results. There's a city in Germany, Tübingen in Germany, where they've done some very common sense things to protect the most vulnerable portions of their population, realizing that 88% of the deaths are in people over the age of 70. Yeah. 40% of the deaths are in care facilities, nursing facilities.
Yeah. What is that, by the way, what is that city doing? I'm just out of curiosity. What are they doing that you said makes infinite sense?
Yeah, they've instituted free testing for anybody that would like it in their community. Now you're going to start running a calculator in your mind thinking, boy, this kind of sounds expensive, but compared to shutting down your economy, there's not a whole lot that's that expensive. Yeah. So they've got free testing. They have provided taxi service for the elderly to keep them off of public transport. They've set aside a couple hours a day, 9 to 11 a.m., where those people in that high-risk category can go and buy their groceries, and others avoid the grocery store at that time. And then they also test the workers at their nursing facilities twice a week. And if they test positive, they give them a couple of weeks off work. All of those things would seem fairly common sense and reasonable. And while the rest of that country is experiencing a surge, it's amazingly calm and under control there.
Yeah. Paul Seegert, our guest, he's somebody that knows this stuff inside out, managing partner, PCS Advisers. I would like to think that the vaccine is 100% safe and that everybody can take it and that we can get to 80% herd immunity. But I know better than that. What happens if we only get 60% taking this vaccine? I mean, what happens at that point? I mean, because if it is true, as we were led to believe early on this, that if you have 100 people wearing a mask out of 101 people, and there's one person who does not wear it, that the mask isn't effective, that everybody has to buy into that. What if we only get to 60%? Where are we then?
Well, there's two ways to get to herd immunity. Either you vaccinate a person, or they actually contract the disease and recover from it, which is the strongest form of immunity and always has been. So we don't know, because of some of what you've pointed out already today, what the numbers really are in terms of how many people have had COVID-19. It could likely be quite a large number, because there are people that have it that don't present with symptoms.
Yeah.
But we're going to get to that herd immunity. It's just a matter of how long is it going to take, and is it when will we get there? We're not the vaccine rollout. We were told as recently as 3-4 weeks ago that there would be 45 million doses between Pfizer, BioNTech, and Moderna that would be in the U.S. by the end of this year. And now it's looking more like 20 million doses, enough to vaccinate 10 million people instead of the 20 to 25 million people.
Right.
And
well, the incoming administration, they're talking about this thing being an answer worldwide as opposed to the United States, and I suppose that's wonderful, but I live in the United States, and I know that there have been some of these companies that have received money to help develop this vaccination that came from my hide and your hide and anybody else that pays taxes. So, yeah, I would like to see that too. But again, that fits right into the narrative about who do you believe? Where do you go to get unbiased, unblemished, and a story, a narration, whatever it may be, of exactly what's going on? And I think until we get that, I think we're going to be in this wilderness where a lot of people simply don't trust the government or trust the vaccine or trust these people that are telling us this stuff. And I think of everything that you and I talked about today, Paul, that's the most dangerous territory to be in.
It sure is. I was talking to a CEO of a hospital this week, and he shared with me that 35% of the staff in his hospital is hesitant to take the vaccine and will only do it if it's mandated. Oh. That's an incredible reality when you're talking about healthcare professionals.
Yeah, it is. It is. Who should know one way or the other? Paul Seegert, great stuff. Thank you so much for doing this, and stay well. We need to hear your voice in the new year. Thank you so much.
Thanks for having me.